Question. A 52-year-old male with a history of chronic alcoholism presents with confusion, ataxia, and ophthalmoplegia. On examination, he is disoriented to time and place, has a wide-based gait, and exhibits nystagmus. What is the most likely diagnosis? A. Wernicke encephalopathy. B. Alcohol withdrawal syndrome. C. Korsakoff syndrome. D. Cerebellar ataxia. E. Subdural hematoma. Correct answer is A. Wernicke encephalopathy. The clinical presentation of confusion, ataxia, and ophthalmoplegia, triad, in the context of chronic alcoholism strongly suggests Wernicke encephalopathy, a life-threatening neurological disorder caused by thiamine, vitamin B1, deficiency. Key features supporting Wernicke encephalopathy. Confusion. Represents encephalopathy due to impaired glucose metabolism in the brain secondary to thiamine deficiency. Ataxia. Characterized by a wide-based, unsteady gait due to damage to the cerebellum or vestibular systems. Ophthalmoplegia. Manifested as nystagmus or paralysis of eye movements, often due to damage to the cranial nerves or brainstem. History of chronic alcoholism. Chronic alcohol use depletes thiamine stores due to poor dietary intake, reduced absorption, and impaired utilization. Why not the other options? B. Alcohol withdrawal syndrome. Alcohol withdrawal may present with tremors, agitation, sweating, and seizures but does not typically involve ophthalmoplegia, ataxia, or the classic triad of Wernicke encephalopathy. C. Korsakoff syndrome. Korsakoff syndrome is a chronic sequela of untreated Wernicke encephalopathy, characterized by anterograde and retrograde amnesia with confabulation. This patient's acute presentation fits Wernicke encephalopathy rather than the chronic phase. D. Cerebellar ataxia. While this condition can cause ataxia, it would not explain the ophthalmoplegia or confusion seen here. Cerebellar damage from chronic alcoholism typically presents without the triad of Wernicke encephalopathy. E. Subdural hematoma. Subdural hematoma can cause confusion and ataxia, especially in patients prone to falls, e.g., chronic alcoholics. However, it would not explain the ophthalmoplegia, and imaging, e.g., CT scan, would reveal a hematoma, which is not mentioned here. Key learning points. Wernicke encephalopathy is caused by thiamine deficiency and presents with the classic triad of confusion, ataxia, and ophthalmoplegia. Chronic alcoholism is the most common cause of thiamine deficiency, although it can also occur in malnutrition or hyperemesis gravidarum. If left untreated, Wernicke encephalopathy can progress to Korsakoff syndrome, which is irreversible.